My name is Alex Gitungano. I'm the founder and director of Justice Health Initiative. I've been living in Boston for almost 11 years. I come from a country named Burundi. Burundi is located in Central East Africa. Economically, the country is considered as one of the poorest countries in the world. The ethnic groups that they have in Rwanda is the same ethnic groups they have in Burundi. When the war broke out in 1993, the ethnic groups were fighting each other. People were killing each other using machetes. I have a lot of family members that were killed during that time. Lived in Rwanda, lived in Congo for different reasons. Political violence and civil wars and genocide of Rwanda, so all of that. My mom introduced me to Christ when I was little, and then I was committed to it. She taught us about faith, but also what to trust God in the middle of the trials, running to save your life because of people who want to kill you. But beyond that, she taught us to live a generous life. I used to see her visiting strangers, taking care of others, visiting people in the hospital, people coming from the village looking for treatment in the capital. There's no one else who could provide food for them because most of the public hospitals don't provide food. So I used to actually go with her and to a different hospital and see what she was doing, praying for them, encourage them, clean them, wash their clothes, providing food. And I loved it. The love she had to people who were around her that made me like who I am. It's like I was seeing Jesus in my own home, reaching out to strangers and to the most vulnerable people in need, and that's what Jesus did. So I saw her doing that, and when I got in high school, I started doing it. I started going there with my friends. So instead of going home, I just stopped at the hospital and go and visit strangers. I didn't have much to offer them like my mom. My mom used to offer them food. For me, the only thing that I could afford was banana and oranges. I was using my school bus fees instead of taking a bus to school. I would, walk for 30 minutes, 35 minutes. And when I went to college, I was doing a lot of volunteering works around different ministries. I got a call to help this young man that was burned by fire. When I saw the picture of the guy, his name is Freddie, and I was like, wow, I don't think I can do that. That's too much. His mom passed away and he was staying with his grandma, and then the grandma went outside to pick up something. She delayed a little bit and he had a seizure, epilepsy, so he fell in a cooking fire, and so the whole face was damaged, complete damage. He was disfigured. After the incident, he couldn't get treatment. There was basically no hope for him, and he was kind of an outcast in the community. He was begging, on the street, trying to, see people who could help him. I've traveled with Freddie a couple of times to Kenya. That's where he was getting plastic surgeries. They would do reconstruction of his face. He had a big graft that connected his mouth. They fixed that. They put metals in his mouth so he can close and open his mouth properly. I thought it's going to be just one trip, end up being multiple trips. We become so close, good friends, and his health improved. When I was done with Fred, I was like, wow, I did great. Freddie went back to his village. He's doing well. He went back to school. And then I was like, yeah, this is great. 6 months after helping Freddie, I got another call, and the call was about Leo. And Leo was another burn survivor, and Leo comes from a big family of 10 children. He's number 9. The mom has just got the 10th child. She took the baby to the hospital, left Leo, the siblings. His siblings left him alone, and he found a cooking fire. He fell asleep, and he got trapped between cooking stones. And whole face was, as Freddie, he got, his face got damaged as well. Especially Leo's eyes were severely damaged. He couldn't see, And again, he was just in a local hospital without hope for treatment. The question that I asked myself was, why? Why are you calling me to do this? I got home and I told my mom, oh, they just called me. And my mom told me, hey, Alex, you helped Freddie, why not Leo? And she reminded me something. She was like, do you know that you will burn as well? I pull up my undershirt and I could see some scars, there on my stomach. Where I grew up, we didn't have electricity and we were using kerosene lamp. I fell twice on the kerosene lamp. Then I was like, yeah, maybe this is the reason why I'm doing this. So I finally say yes. I traveled with Leo to different countries and tried to get treatment. We went to Uganda, Rwanda, and other places for treatment. Everything failed. We didn't know what is next for Leo. So we came back home, and then we find Shriners Hospital. Through long connections of people, Shriners Hospital wanted to treat Leo. But the question was like, who's going to travel with Leo to the States? I had my own plans, going to grad school and find a job. And then I was asked again, are you willing to help Leo? Are you willing to travel with him to Boston to get treatment? So I said, yeah, I can help for 6 months. We went to apply for a visa to prove that everything was legit. I brought Leo's father to the interview. They interviewed him and they asked me a lot of questions, and his father as well. And we find ourselves in Boston. I had no idea. So coming to Boston was tricky because I just graduated from college. I had no idea how to take care of a child. It's one thing to love kids, it's something else to raise them. And here I am in the country where I don't know anybody. I have no family members, different culture, different language. Everything is new. For Leo, the language is new, nutrition was new. With a toddler who has special needs, how are you going to navigate this city? How are you going to find the basic needs that you need? But I was like, wow, why did I sign up for this? I feel like I lost all my freedom. As a young man, I would go wherever I want to go. I would go out and come back anytime that I want. And now I don't have the freedom that I had. And I got homesick because I was trying to call my mom. I had a prepaid AT&T phone, and I was trying to, this is before WhatsApp, and I was trying to call my mom, and it didn't go through. I was so disappointed because I wanted to talk to her. I wanted her to encourage her to pray for me. I was broken down. I was like, okay, God, now you need to help me because I don't know what to do. I don't know how to take care of this child. When I got in Boston, I thought I'm going to be here only for 6 months. Take care of Leo and then, go back and do my own things. Before they did the first surgery, they found out he had MRSA, so they had to treat that first. So it took the whole month. My commitment was only 6 months, so now I have 5 months. And they started doing the first surgery. And they did the second surgery, and they did the third surgery. 6 months was over. I was like, hey, my commitment was only 6 months. I need to go home. The surgeon came and said, hey, look, if you can stay a little bit longer, I can do a couple more surgery and then you'll be ready to go. We only knew we were going to stay in the hotel for 2 weeks. We had to find other places. And from there, we started moving from homes. People hosting us for a couple days, couple weeks, months. It was a little bit hard for Leo because for me, I was used to it because I went through the political violence in Congo and the civil war in Burundi. I experienced a lot, so I was fine. I used to fleeing, running to save my life. But for the little one like Leo, we are staying here and we have to pack everything, put everything. We had only two. He has his suitcase and I had mine and two little backpacks. Suddenly things changed. There was political unrest. So we got stuck here. My dad passed away during that time. My family fled to another country. I was like, where's next? What are you gonna do? You're far away from your family, from everyone. So the question that I was asking myself, like, where's next? Where's my future going? I was at the playground. I saw just a lady who was taking care of a little boy. Back then, Leo didn't speak English. And the two boys, Leo and the other boy, they started playing together. So I started talking with the lady who was taking care of the boy. While we were talking, she started crying. And she heard my story. And I say, whenever I look at Leah, I see God's face. And the woman also start crying. She couldn't wait to get home and share our story to her friends. And then one of her friends used to work with the Boston Globe. The story reached out to a lot of people, millions of people. I remember walking downtown Boston, people would recognize us. And they're like, hey, we just read your story. What an amazing man. I was like, oh. I'm just trying to help. And then people invite us in their homes for dinner. People bring toys, clothes for Leo. People would bring checks, money, and I didn't have a bank account. We had only 1,000 when we got in Boston. But then people started reaching out to me, hey, Alex, do you want to help more people? And I was like, oh, I don't think so I can do this. I was able to help Leo, Freddie, and others, but I need to figure out about my life. When we got stuck here in Boston, we kind of open up so that this is going to be an adoptive home. On top of that, also Leo's mom passed away. My dad passed away. I ended up getting the whole legal guardianship, of Leo and taking care of him as my son, as adopted son. After giving my life to Christ, this is one of the biggest decisions that I've ever taken. I was like, wow, I'm a father now. So I had to figure out how to raise this young man. So I've been raising Leo for close to 11 years, and he's 14 years old now, and he's still getting plastic surgeries. He's taller than me. He's almost like 6 feet. It's interesting to see how he's growing, his personality, and he likes basketball. I was like, so now what is next? What am I going to do here? How am I going to survive in this country? So I thought about going to school. And because I was getting more requests from people to help others, and I didn't have the capacity. So I thought that, if I get more tools, skills, that will help me to help others. But I didn't know how. It didn't make sense. Like, you also have a dependent. So how are you going to do all of that? I ended up getting into BU, Boston University. I did my grad school in public health, program management, and global health. My classmates used to hang out and do things. I was like, I cannot do that. I have my father. I have to go home. When I graduated from grad school and I got a job, people didn't stop. They kept reaching out to me. And I just didn't know how I can help. I didn't know what to do. I didn't have any organization. But I remember one time I was reading Proverbs 31, verse 7 to 8. It says, speak for those who cannot speak for themselves. Defend the right of the needy and the poor. I started asking advice and praying, God, what do you want me to do? I had no idea to start a non-profit organization. So I met a friend of mine. We talked, and she also ran her non-profit organization. She said, Alex, I think you can do this. And I think this is the calling of your life, why they keep calling you. So I quit my job, and I transitioned to full-time for JHI. The vision basically was to build a platform or just a way of helping children with rare and severe conditions. And there's no way they can be treated. They have complicated medical condition, but they don't know where they can get treatment. JHI was born to give hope for these children who have no hope for treatment. We help the patients. We figure out the hospital they can get treatment. We have to raise money, and we have to help them with the legal process. Whatever they need, like if they need a passport or they need a visa, wherever they need to travel from one country to another country. So you have to raise money to cover those needs. You have to find housing, make sure they have live in a stable home. Even if they live in a hotel for a short period of time, we're making sure that their needs are met. So it's the holistic healthcare, not only physical, but social need, emotional need, spiritual need, whatever they need. In the beginning, it was only Africa. Now we're getting cases from Asia. We're getting cases from Europe, Middle East. Everywhere we're getting cases. Right now, being pulled everywhere. Patient coordination, marketing, figuring out fundraising, talking to the hospital, trying to figure out all other logistics. It's easy to get burned out. Some people tell me, Alex, what you're doing is crazy. How are you doing that? It's so complicated. If it were easier, everyone would have done it. So I believe that God is calling everyone to be feet washers, like the way Jesus washed the feet of his disciple. And I also believe that if you look around, there are people who are suffering. There are people in need. You don't have to do like what I'm doing. You can do something else, but you just have to look around and come out of your comfort zone to better understand what someone is going through, what Leo is going through, or Freddie, or someone else, is to get close to them and listen to their stories and ask God, what can I do? Why am I here? Would you help me so that I can help someone else? How are you going to help them if you don't know their story? If you don't ask them a question? The better life you can live is the life of giving to others while you are living. And that's what Christ did. He gave his life for others. And he said, if you want to gain your life, you have to lose it. And I want to just invite people in to be part of this. To learn more about JHI and how to partner with us, visit us at jhinc.org.